Hey everyone, and welcome to MediByte. Today, we're going to break down a super common childhood illness that, let's be honest, can cause a whole lot of stress for parents and caregivers. We're talking about hand, foot, and mouth disease. So if you're feeling worried, a little confused, or you just want to be prepared, you are in exactly the right place. You know that moment, right? Your child feels warm, they're definitely not their happy self, and then you see it, a rash. Your mind can just race to all sorts of conclusions. Well, let's just take a breath. We're going to demystify one of the most common culprits behind these exact symptoms. All right, so here's our game plan for today. We're going to walk through this step by step. First, what exactly is hand, foot, and mouth disease? Then we'll cover the signs you need to recognize. After that, it's all about practical tips for treatment and home care. And we'll finish up with how to effectively prevent it. All right, let's jump right in. First up, what in the world is this virus with such a literal name? Let's get to the bottom of it. Yeah, that name sounds pretty dramatic, doesn't it? But here's the deal. Hand, foot, and mouth disease, or HFMD for short, is a really common and usually pretty mild viral thing. It mostly hits kids under 5, and the usual suspect behind it is a virus called coxsackievirus. So, yeah, it's no fun, but for a lot of little ones, it's almost a rite of passage. So what makes it so common in places like daycare? Well, it spreads like wildfire. It's in the droplets from coughs and sneezes. You can get it from touching the fluid from the blisters, or even just from touching a toy that an infected kiddo has played with. And yep, it can also spread through feces, which makes diaper changes a prime time for it to hop from one person to another. And here is a piece of info you really need to know. The virus is at its absolute peak contagiousness during that first week of sickness. That's when you have to be on high alert with hygiene to try and protect everyone else in the house. Okay, so we know what it is and how it gets around. But how do you actually spot it? What are the telltale signs you should be looking for? It usually kind of rolls out in stages. It often kicks off with a fever and your child just feeling blah. Tired, maybe a sore throat. Then, a day or two later, these really painful sores can pop up inside their mouth. And after that, the famous rash shows up on their hands and feet. But here's a heads up. The name is more of a guideline than a strict rule. Hands, feet, and mouth are the classic spots for sure. But don't be shocked if you see that rash, which can look like flat red spots or even little blisters on their legs, arms, or even their butt. Now, here's a major tip for all the parents out there. Pay attention to their behavior. Sometimes, one of the very first clues is when your child just flat out refuses to eat or drink. It's probably not them being fussy. It's because those sores in their mouth make swallowing super painful. Okay, so you've put the pieces together and you're pretty sure it's HFMD. So what do you do now? Well, the good news is that treatment is all about comfort and managing the symptoms, and you can do all of it right from home. Now, because HFMD is a virus, antibiotics are totally useless here. There isn't a magic pill to make it vanish. The goal is just to make your little one as comfortable as you possibly can while their own amazing immune system does the hard work of fighting it off. All right, everybody, lean in for this one. This is so important. For the fever and the pain, you can use kids' acetaminophen or ibuprofen. But, and I can't say this enough, you must never give aspirin to a child. It's linked to a very rare but incredibly dangerous condition called Reye syndrome. So no aspirin, period. I know, trying to get your child to drink anything when their mouth hurts can feel like an impossible task, but it is one of the most important things you can do to prevent dehydration. Think cold, soothing things, milk, ice pops, maybe some yogurt. The mission is just to keep those fluids coming, even if it's just tiny sips here and there. So now, let's talk about the best strategy of all, plain defense. How do we stop this virus before it even gets started? How can you protect your family? Honestly, it all comes down to 3 core habits. Number 1, and the most powerful by far, is washing hands. All the time, thoroughly, with soap and water. Number 2, disinfect those high-traffic surfaces and toys. And number 3, try to avoid close contact, like hugs, kisses, or sharing forks, with anyone who's sick. And when we talk about disinfecting, you don't need some expensive, fancy spray. A simple solution of regular household bleach and water works wonders. Just mix a 1/4 cup of bleach into a gallon of water and use that to wipe down all the hot spots, changing tables, doorknobs, faucets, and plastic toys. This one sounds like a no-brainer, right? But in the chaos of a busy home, it's so easy to slip up and forget. The virus spreads really easily through saliva, so just making sure everyone has their own cup and their own fork is a small change that can make a huge difference. Okay, let's do a super quick recap. Key takeaways. Hand, foot, and mouth is common, it's contagious, and it's a virus. Look for fever, mouth sores, and that classic rash. Treatment is all about comfort, pain relief, and absolutely no aspirin. And pushing those fluids. And your best defense? Wash those hands and disinfect everything. And that leads us to one last thing to think about. We've talked a lot about what to do inside our own four walls, but HFMD is really a community thing, isn't it? It sweeps through daycares and schools. So maybe the bigger question is, what can we do as a community to help support those childcare centers and each other when these outbreaks happen? And that's a wrap for this MediByte Explainer. Thank you so much for joining us. If you found this useful, do us a favor and hit that like button, share it with another parent who might need it, and of course, subscribe for more clear, straight-to-the-point health info. We'll see you on the next one.